Cole Stanley. I'm a family physician in Vancouver. I work in HIV primary care and I work in a new clinic for the marginalized and vulnerable in Vancouver's downtown east side. I'm sitting here in Yaletown in Vancouver. It's a fairly upscale neighborhood. If I was on a higher floor in this condo building, I might be able to see Vancouver's downtown east side. Okay, and the people living there, the adult male life expectancy is probably 2 decades shorter than the average where I'm living. Okay, and
Hi, everybody. So my name is Dawn Trotter, and I am a part of the Ages Across the Lifespan Affinity Group. I am a content expert. I have been living with HIV for 14 years now, so I am a consumer. Uh,
Hi, everybody. I'm Dr. Kathleen Clannon. I live and work in Oakland, California, and I'm working in the Housing Affinity Group. I think housing and home, they're a little bit different. They're both really important for human beings, but you can't really do anything about your health if you don't have safety and a place of peace to call your own and to protect yourself.
so, when I think about social determinants of health, um, they're really at the core of what we see in our clinic. I think if you're skipping over these and not considering these, you're missing the boat.
There's one of my patients that I talk with a lot about health and justice, and she calls it social deterrence to health instead of social determinants of health. That always made a lot of sense to me. It's the things that get in the way, the things in our society that get in the way of people being able to reach their best health, their longest life.
Ages, different things affect us in different ways. So when it comes to, say, for instance, if I'm a teenager, I'm not so much worried about going to the doctors if I don't have somewhere to live.
I figured out, instead of continuing to learn all the minutia of the different resistance patterns and for the drugs, I need to devote more of my time to considering the underlying social determinants and especially substance use. How do we better treat substance use so that our clients can maintain viral suppression?
Doctors know intellectually that a house and a home are important to the health of their patients, but a lot of us are afraid to even ask about whether people have a safe place to live. We don't like knowing that there are dangerous things happening to our patients that we don't know how to fix.
If you as a provider are comfortable talking with your clients about all of the things that encompass their life and in their health, then you will be able to get the true answers you need to make sure that they're living a healthy life. So for me, feeling comfortable and possibly having the providers in the same place was a huge benefit for me. One of the barriers for me was the time, in my life that I was in active addiction and having to not be in the same place where the provider and the doctor were on the same page. It was a huge barrier for me at one time. And also feeling judged. I didn't want to talk to my doctor at first about my active addiction because I thought they were going to judge me.
One of my weekend shifts where it was a slow clinic, we had drop-ins, but this guy kind of stumbled in, no shoes on, looking quite disheveled, but at the end of his rope, wanting to stop his current pattern of opioid use. I sat with him for about an hour and, he left with a methadone prescription. I was almost sure that he would get that filled. But the next day I checked the dispensing record and he never filled that and I never saw him again. It says human connection changes direction. And I always think of him when I try to keep engaging patients, even if they initially aren't ready to fully engage in care or go on medical treatment, just to keep offering and showing that you're there and you're ready when they are.
I have a patient named Yvonne, and she has bipolar disorder. She did really well, though, undetectable and happy, painting. And then all of a sudden, she fell off the map. Her mom had died, her mom that she'd been living with, and ultimately she lost her place. When I saw her in the hospital after that, I didn't recognize her. She was dirty, and she was scared, and she was closed up in a way that I had never seen her in all the years I'd known her. But just being inside with a lockable door and some peace, we were able to get her back on her medications, help her find family, and get back on an even footing. And over that whole year, over last year, that nightmare, it was all because she lost her place.
If you bring a consumer to the table to be a part of their own care, to make sure that the things that are going on there in clinic is meeting that population. If I feel like you hear my voice, you're making sure that you hear what I say and you're implementing it into your clinics, I'm more apt to want to come to you when I'm having a problem, when I need to come to the doctors. And then also, if you have consumers that are a face, say, of your program, then there's the support that we can offer to other consumers that may not feel so comfortable to tell you all of the things you need to know to make their health the best it can be.
Yeah, and when we're thinking about social determinants of health, we need to think about the intersection of the various determinants. If we're seeing more than one, often it's people with these multiple disparities, multiple gaps, uh, who need the most help. The irony here is they are often the least equipped to access our services, but we're unable to titrate our level of service up to them, especially when we're in this situation where we're just providing reactive care. The worry is people could get left behind. So we need to think about this and make sure that social determinants remain at the forefront as our medical system continues to evolve.
In order to be healthy, you have to have a home. If we can, through this collaborative, get to the point where we're working with everybody, we understand what their home and housing issues are, and we help them get to a home, I believe that we will be able to end this epidemic.
Medicine, it can be very easy these days to just write a prescription and give people a pill, but we often find that the outcomes aren't what we want if we don't have these underlying things at least considered. So some social determinants we can't change, things like gender or certain things about culture or race, but we need to know about these and need to consider these. Other things like the physical environment, like housing, income, social supports, things like this. If we're considering these and trying to actually improve these, we have a much better chance of better outcomes for our clients.
So if I had one hope that I would like to see come out of this initiative is one is to have more consumers at the table that feel like they have a voice, and that they become active within their agencies, and that they feel like they understand the things that are going on in the clinics and why they need to do certain things as far as like surveys and just so that they feel they have a say in their care.
So why am I getting involved with this collaborative? Well, I think I stand to gain a lot for my work as well. It's a huge group that we're working with, and I know people all have their own ideas and are able to innovate. It's this huge crowdsourcing mechanism, and I hope to take things back to our clinic in the downtown east side and be able to share that knowledge and then bring things back to you guys and share across our border.
I think that this collaborative can be a center of healing for us to really face the things that are wrong with our society that keep down people and prevent them from being healthy. And that center of healing, I think, can have ripples all the way through our society.